This work is kind of a bit of a continuation and also an expansion of what we've already been doing with the acute Ebola response. But Liberia was one of the 3 countries that was devastated by the outbreak. I mean, roughly 10,000 deaths. And, and one of the populations that was most affected was healthcare workers. As patients came in, they became infected. And so really this grant's about really strengthening the healthcare system so that we can prevent infections within the hospitals, so infection prevention control, and then be able to identify cases that are communicable diseases. So identify Ebola, identify other hemorrhagic diseases, communicable diarrheal diseases like cholera, yellow fever, things that we want to prevent and stop as soon as possible. Really training hospital workers on how to prevent infections and identify infections is being led by Michelle Mashrenko at Boston Children's. She and a large team are going out to, I think, some 30-odd hospitals, essentially maintaining training over the next 2 years so that they're prepared for if Ebola reoccurs or any other highly infectious disease. UMass is mainly focused on the laboratory, so we're working to make sure that we have the laboratory testing and building sustainable laboratories for public health to detect these infectious diseases. What we're really trying to do now is move towards really permanent and sustainable laboratories where we have things that we still don't quite have, like continuous power. So right now in Tapeta, we'll test early in the morning and then there's a break as the generators go down, and then we'll pick up testing later in the afternoon. So really where we have highly functional labs with properly trained people and really working to train the librarians so that these labs are theirs, and then if there's a new outbreak with a new disease, they have the skill set to start and do a test themselves. And so having that ability and that constant monitoring will really ensure that we never have an outbreak of the scale that we saw.